Hi, Barbara. It's nice to see you again.
Yes, very nice to see you after almost 5 years.
It has been, what was it, 2018 up in Dundee, right? I think, or 19?
19, yeah,
Okay, got it.
19.
Got it. All right. So briefly introduce yourself. Who are you? Where do you live? Where do you work? What do you do? All those good things.
Yeah, so my name is Barbara Tanze. I live in Slovenia, even though I'm half Swiss, half German, long story. Um, I am a singing teacher, professional singer. I have a master's degree in vocal pedagogy, and I've been working as a breathing facilitator for the last 10 years, including also a lot of manual work that I do. And I'm also now just finishing my studies to become a manual therapist. So
Great.
on top of the training that I did with you, Walt, in 2019, as we just said, I then decided to also go deeper and not only treat all of this and the breathing mechanism, but the entire body.
Yeah, that's great. That's great. So you took the class in 2019, and in those 4 years, if you took the class again this year, you'd say, "Wow, a lot of content has changed," which is, I guess, how everything should be evolving. But based on the class back in 2019, how did you find that it fit? How did you begin to apply it?
I began quite immediately, I have to say, because I was so excited about it. And I just felt that this was really one of the things that were still missing for me, especially working with singers. Because as I had already done manual work on them for the breathing, this just gave me an additional tool to also add in the jaw and the tongue and all of those structures that I didn't really dare to touch before. But I find that the way that we approach it is it's because of the whole being patient centered and with the shared decision making, it's really something that benefits the client so much without really putting a lot of risk, you know,
Yeah.
on also on us, especially for me, since at the time I was not a manual therapist, it wasn't really about doing any therapeutical treatment, but just trying to find out together with a singer or with a person, um, what is going on where? Where's the, how did you say, like the chicken? Where's
The
the chicken?
frozen chicken. Yeah, yeah.
Frozen chicken. And then just creating awareness about this. I'm also with my manual therapy clients all about educating them, you know, what's going on there? How do those structures look? In what way does that muscle move so that they have a better picture of what's happening inside their body? I call it like wipe out the white spots on their on
Mm.
their map.
Hmm. That's great.
So it's really about creating for them a closer link, a better connection between what their brain is organizing for them in their body and how they perceive it and understand it, um, and yeah, and make it also conscious.
Yeah. How about your transition? Did you find it at all difficult, not only for you applying the work, like taking a new work and say, how do I slip this in? But also that problem that I think a lot of people can relate to is often the challenge from the client or the patient perspective of them being so used to us as the expert sort of dictating and saying what's best for another person. This shared decision making model basically wipes that out and says, what do you think, patient? Did you find that at all a challenge, or did your patients?
Um, I have to say, not really, but that's
Good.
probably because I was not, a physical therapist before or a manual therapist before. I had not worked with a modality before that actually expected from me to be the one sole decision maker.
Hmm.
So it was quite organic because it came more from the teaching perspective. And for me, I mean, I know that there are also teachers out there where it's like, it's my word because I know, but
Yeah.
I'm not a teacher like that. It's always been very much, a dialogue. And I think I just took this kind of educational perspective into the therapeutic one. And so it worked together brilliantly.
That's great to hear, because I know so
Mm.
many people really struggle with that. The fear of looking like they're less than sure or less than certain, right? And I love that aspect of like being vulnerable and sharing that, I do know a lot, but what do you know about this? How does this feel to you? And how about your patients, their experience with it? Yeah, anything, do you have a little, maybe a case story or vignette that you want to share?
I have so many. And another thing I wanted to say is that I like to tell my students, my clients that I might be an expert on certain things, but I'm not an expert in how they feel.
Yeah,
They are the experts on how they feel. And so we need to work together. And usually that works really, really well.
yeah,
And one case that I'm working on right now, we've been working together for about 4 months now, 4 or 5 months, is an absolutely wonderful lady who had a hypopharyngeal tumor on the left side. And with this basically dysphagia, like it was really, really hard after radiation therapy to swallow,
yeah.
or next to impossible, to the point where the doctors decided to just put in a gastrostoma and that was it. They also told her that she would never swallow again, and that got her really scared. She became really, really frightened of swallowing, but she felt like she didn't want to give it up. And so, yeah, we've been working for 4 months. And in the beginning, it was bits of water and maybe a little bit of like a smoothie or something. And now we're up to a slice of bread with butter and a lot
Hmm.
of chewing. But yes,
Right.
that is
That's
pretty
great.
amazing. Yeah.
That's great. That's great.
Mhm.
Any advice you'd have for newbies? These
Um,
questions at you here without much
that's
prep.
fine.
So yeah.
But I think just to embrace this, exactly what you said before, like embrace this, that it's a dialogue and it's a collaboration with the person in front of us, and just using what they know about themselves
Hmm.
and what we know is like a joint venture, because anyway, whenever we work on a person with our hands, basically we are working with that person's brain, right?
Yeah,
So if we are working with that person's brain and the person knows it and
yeah,
can actually tap into that,
yeah.
that's when like we can really create magic together.
Absolutely. We are so in sync with that too. That concept that I think manual therapies of all sorts have just sort of like deluded us to think that somehow we're masters of this one tissue or structure. I think it's just so wrong.
So
We're working with another individual, not their individual tissues. So I'm as you know, I'm directly on board with that. So how
yeah.
much in your own career, like not just this manual work, but all the breath work that you do and some of the other works that you combine, how has that affected your own, life as a professional singer?
It has totally confirmed those things. It's so nice to not be the only one out there who kind of works like this and thinks like that. It just gives
Mhm.
you so much um, confidence, because it is true that in many of the, like in the manual therapy world or physiotherapy world, you're very often we're thinking in like certain modalities or
Mhm.
methods. Oh, even just methods. I had worked with one method before, and all those methods, they kind of think that they're correct and they're right
Yeah.
and the other ones are not, and to kind of break out of this, I felt a little bit lost, and I was a bit scared of, like going out into the world without having a method behind me.
Mhm.
And this work really reconfirmed to me that no, it's we can do this by ourselves,
Yeah.
just keeping our eyes open and not falling just for simple truths, because truths are never simple.
Yeah. Oh, that's very well put. Yeah, very well put. Great. Anything else you want to share?
Just thank you very much for everything you
Oh,
put out there. I'm so happy also to be in the Facebook group where we are kind of still discussing things, and it's so supportive. And the things that you put out there for us, then, to watch, it's just great. It's a
well,
completely different experience from the one that I had in a method before.
that's great. I think, this only happened in the last year and a half. I started videotaping absolutely every lab from every seminar and uploading them to that
Mhm.
Facebook group that's reserved for people who've taken the class. And, unfortunately, they don't, Facebook doesn't allow me to see how many people are actually viewing it. It could be one, it could be hundreds. I have no idea. But I just think having an opportunity, to me, it's not just about, what do we do with our hands, but how might we engage another human being in front of us? And I hope that's the richness of those videos that really can shine through from that group. So thanks for mentioning that.
Yes, and just the
Yeah.
question, does this feel useful to you? In all of the languages that I'm using this in, it just makes so much sense and it creates such a bond between the client or patient and the practitioner. So that's
Yeah.
really cool.
And sort of the revision of my own language, does this feel useful, is a newer one for me. But even today here in my practice, I still get people like looking at me like, that is the stupidest question a therapist has ever asked me. But then they sort of reflect on it. It's like, well, wait a minute, maybe I do have value in this relationship. And not every patient of mine really sort of buys into this shared decision making, but the ones that do, I think just really thrive.
Yeah, I think I'm just very lucky because the people who come to me, they are usually they have tried a lot of things and they are usually very open to this, or actually they feel so relieved, that
Mm,
finally somebody takes them seriously. Because, like the lady that I told you before, she had gone to doctors and they all just said to her, no, there's nothing you can do. You're just not ever going to swallow ever again. And she felt that this was not true. And
yeah,
coming to me, I think it was actually a big part of the success that we are having together, that I was ready to say to her, okay, well, let's give it a try.
yeah.
Does this feel useful to you? And just taking her seriously. And especially when it comes to muscle tension, dysphonia, all of those kind of things where we don't really have any functional issue, like, or like we don't have any pathology, it all looks
Mm,
great and they come from the ENT. They have their vocal folds are fine. I get all of those texts where everything's fine, everything is pink and everything's great,
mhm.
but still they can't really swallow well, or they can't use their voice well, they can't go to the higher notes. And somebody just listening to them and saying, yeah, I validate that you're feeling this.
Yeah,
And now let's, you know what, let's work together and try to find a solution. I don't promise you that I have a solution, but the best thing we can do is to unite our forces, work together, and try to find a way out.
yeah. Oh, that's so well put. Thanks. And thanks for spending this time. I think this is an important series that I'm doing just to kind of guide people, newbies and people who've been doing it for a while. So I do appreciate your input.
Oh, you're very welcome. I'm
Great.
really, really happy about the input that you gave me 5 years ago. So,
That's great. Yeah. All
and you
right.
keep following me, so I'm still following you, of course, and it's just wonderful.
Great. And where can people find you, Barbara?
People can find me on Instagram, for example. I do a lot
Yeah.
of like breath awareness kind of things where it's not just about, again, breathing correctly or incorrectly, but it's about like giving you food for thought. So that's BT breathing on Instagram. And my website is www.voiceup.si. And if anyone wants to come see me in Slovenia, it's worth a trip. It's just
I would look
beautiful.
forward to that. Yeah. I love what you just said too. It's not about breathing correctly. It's about the awareness. And to me, that embodies not just breathing, but everything we're doing. It's like I think we get stuck in those models or those mindsets. There is a correct way. And I think that just sort of minimizes the broadness of human experience.
Yes, and it can traumatize people into thinking that something they do is wrong, but it was
Yeah.
just a misinterpretation of something that they read. And
Yeah.
so it's really always about experiencing something, then kind of talking about it, creating that language, that common language between the client or the patient and us.
Yeah.
So that also for us, I tend to just ask people, how does this feel? And then I write it down so that then next time when we want to kind of get that feeling again, then I speak their own words back to them.
Mm,
And I don't just, make something up that I feel, because what I feel is not necessarily what they feel. So
exactly. Yeah. Great. All right. Thank you so much.
thank you.
Okay. Okay, so we leave that long pause so I can edit that from here. Thanks so much. Boy, that was great. Thank you so much. Very
Oh,
helpful.
thank you. It's just so cool, all the things that are happening because, well, because I'm doing what I learned from you.
Well, and you're also what I hear is you're also combining it with who you are and what else you know, and that's what I just love to see. Planting these little seeds and watching the trees grow, and not just that I'm the cause of that tree, but I'm this contributor to this bigger
Yeah.
piece of it. That's what I so enjoy about what I do, and when I
Mm.
hear what you do and what the next person does, it's like, wow, that is just such cool work, and it is humbling to know that I or we can have a part in that larger piece. So thanks so much.
Definitely. Oh yeah,
Yeah,
no, absolutely. And I
yeah,
like I really hope that one day you will be able to come to Slovenia. It's it's really beautiful, even if you just come for a couple of days of
yeah,
holidays.
yeah. Sounds lovely. All right. Thanks so
Well, thank
much,
you very
Barbara.
much.
And
Okay,
I will certainly tag you, and I'll probably get this up today or tomorrow. They don't take long to edit out and then put up on YouTube, etc. So, all right.
great.
All right.
Thank you very
Thank you.
much. Have a
Bye.
great day.
You too.
Bye.